Well, thousands of college students across the country are now on Thanksgiving break and headed home for the holiday. College campuses do have a variety of plans for students after the holiday, including COVID-19 testing or virtual learning through the end of the semester. Dr. Stephen Thomas is a professor of medicine, microbiology, and immunology for SUNY Upstate Medical University in Syracuse, New York. He's also the division chief of infectious disease. So, Dr. Thomas joins us now. Thank you so much. To take a look at the state colleges of New York and its COVID-19 safety protocol for the campus community. So, Dr. Thomas, can you talk about how SUNY plans to test, we know, around 140,000 students before they leave campus? How are they doing that?
Yes, so the first thing I would say is that testing prior to departing campus is mandatory. So if you have taken at least one class on campus or are using on-campus facilities like the gym, for example, you must be tested before you leave. The second thing is that you need to be tested within 10 days prior to leaving. And we prefer that you get tested and you have a result as close as possible to your departure. So in terms of the plans, it's actually happening. And so we're about 90% done with the testing. We've been testing anywhere between 15 to 18,000 people a day. We're using what is called a pooled technique. So everyone provides a sample, 12 people's sample then gets concentrated into a single sample and we test it. If it's negative, you can move on. If it's positive, we then go back and test each individual person. So yeah, so we're almost done with those 140,000.
Wow, so you said 90% done. So obviously something's working here. But question though, are the self-administered saliva swab diagnostic tests really as accurate as other tests, maybe the nasal testing?
Yeah, so the first thing that I would say is that, not all tests are created equal, and that's the same whether you're using a nasopharyngeal swab or you're using a saliva test. There are numerous studies out there that show that saliva-based tests are at least as good, and in some cases, they're actually better because the virus can appear earlier in saliva than it might appear in the nasopharyngeal cavity. Sometimes you can have higher concentrations of virus, so it's easier to get a very good sample. And the virus seems to persist in saliva longer than in that nasopharyngeal space. But in the end, for these tests to be able to be used for patient care, you need to go to the FDA and get their review of your data and the performance of your test, and they need to issue an emergency use authorization.
Okay, well, along those lines, Dr. Thomas, when do you think more of those self-administered tests will be available to Americans?
Yeah, that's a really good question because, there are lots of potential benefits from a self-administered test. And there are two different kinds. So one is you collect the sample at home, but the test actually goes to a laboratory where the actual test is completed. And then the other would be that you take the sample at home and you actually conduct the test at home. There's only been one of those tests approved. That was about 5 days ago. The FDA issued an emergency use authorization for that test. But there's lots of potential advantages because you could have you do not want a sick person coming to the emergency department if they're otherwise, okay and don't need an emergency department. You don't want them coming into a crowded office. The problem is that not only does the test have to perform well, but you have to prove to the FDA that the sampling technique works well, and that if there's shipping involved, that the sample can be properly shipped at a certain temperature and lasts over a certain number of days, certainly hours. So it gets very complex, and that might make certain developers shy about pursuing that type of testing.
Oh, it's absolutely a process there. Okay, Dr. Thomas, we're going to throw out some numbers here. So we know currently the rolling 7-day average positivity rate across SUNY campuses is around 0.9%. We also know statewide that number is closer to 3%. So can you maybe explain the disparity there between those numbers? But overall, what do you attribute that low percentage to as far as SUNY campuses at 0.9?
So I think the first thing is, as with most things, it's leadership. So the governor, the chancellor, down through the university presidents have all said the same thing. COVID is a threat to in-person learning, and if we want to continue to have in-person learning in the SUNY campuses, we have to diagnose infections before they occur. So that's the first thing. The second thing is that, by and large, the student body has accepted that information. They agree with it, and so they've been compliant with the public health behaviors that are mandated for students. students that don't follow those behaviors are held accountable. So that's the second thing. The third thing is what we've been talking about, which is testing. So aggressive testing is occurring not only in ill people, but also any of those folks who have had contact with that ill person. And there's been regular testing on campuses. Anywhere from 30 to 100% of the student body is being regularly tested. And so they are finding people who are infected and infectious very, very early in that infection, and they're able to isolate those people. They're able to do the contact tracing and then prevent additional infection. So I think it's a combination of all those things, which has resulted in a 0.9% positivity out of over 500,000 tests performed to date.
Yeah, so something definitely seems to be working there. Dr. Stephen Thomas from SUNY Upstate Medical University in Syracuse, thank you so much for joining us tonight.
Thank you.